Wellness for Life is brought to you by Perm Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Atwa Community Action Partnership, and Lakeside Sports and Pain Clinic.
Hi, I'm Dr. Mark Wheaton, physician and owner of Lakeside Sports and Pain Clinic. And today we're going to discuss issues involving the neck. Now, neck pain is a very, very common problem, and it comes with a whole host of diagnoses. Whether physician or therapist or just a search on the internet, you can come up with a lot of different diagnoses, some of which are very commonly understood: pinched nerves, herniated discs, and of course the accompanying neck pain that usually comes with it. So today I'm going to examine a patient who has had some chronic neck pain, and my focus is going to be on looking to see if there is any connective tissue issues that are resulting in her pain. And when I say connective tissue, I am referring specifically to ligaments. Ligaments are the support structures of the neck and actually every joint in the body. So right here we have these grayish structures with the fibers in it are all ligaments, and there's ligaments at each of these vertebral levels as well. And all these structures are generally injured or stretched in a person with chronic neck pain. So this process called prolotherapy addresses this problem. And so when these areas are treated with the prolotherapy solution, it creates more stability over time, less neck pain, less headaches. Now, if we look over here, the muscles in the neck are often the tissues where a patient will report feeling tightness, tension, knots, other things like that. And so those structures are improved and they decrease in spasm and pain when the ligaments that we just looked at are strengthened by the process of prolotherapy. So the muscles generally are the secondary problem because they compensate for the weak ligaments underneath. So the procedure called prolotherapy is really the only treatment that can address this problem. So let's go to the patient and do a brief examination. So I'll ask the patient to turn her head to the right as far as she can go, and then go all the way to the left, and then all the way back this way, and then down. Okay, so she has a fairly good range of motion of her neck, and next thing we'll do is I'm going to have her lie face down on the table. I will feel the back of her neck where most of the neck pain and tension occurs, and I'll just use my thumb to compress the tissues, and what I'm feeling for are tight bands in the muscle. And when I feel a tight band, it usually corresponds to where the patient feels pain. And that pain will often radiate up into the back of the head, sometimes over to the forehead. It's called referred pain. Sometimes the pain will shoot down the arms into the hands, and it is usually a very, very troubling problem for most patients. So the way that I treat the problem is usually very simple. It's a straightforward natural injection process called prolotherapy, and there's no other treatment like it. What prolotherapy does is it utilizes natural substances such as dextrose or other simple substances, and when injected with a fine needle into these tissues, the ligaments of the neck, it will provoke a very mild inflammatory response. Now that inflammatory response will start to promote healing, and it increases circulation and pulls in new tissue cells, fibroblasts are called, and more collagen is created and ligaments become stronger. So that whole process, when done over several months, will result in a stronger ligament, and the ligaments will then create more stability in the neck, and more stability means less pain. So what I would do is just take a syringe with a needle and just pepper the ligaments, and I'll show those to you in the diagram. Do the same thing on this side, And the patient responds usually very well to the shots because it only lasts a minute or two. And after the process is done, the patient will sit up and within a few minutes will be able to stand up and exit the room. And over the course of a couple days, the soreness wears off and the person can go about their normal activities. So there's very little downtime with this, and what I like about mostly about this is that it's natural, and the healing process goes on without any need for surgery or medications. So if you'd like to know more about how to treat neck pain using the process of prolotherapy, call us up at 952-593-0500 or look up drmarkwheaton.com, and we would like to help you with this problem. So many issues can be resolved by prolotherapy, and it is the underlying problem of ligaments that is really where this stands out. Thank you.
Thank you for watching Wellness for Life. Brought to you by Perham Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Atwa Community Action Partnership, and Lakeside Sports and Pain Clinic.